Today, we'll be discussing with you more information about our career opportunities at Ochsner and some of the questions that I've been getting in response to how we're handling COVID-19 and what hiring looks like for us right now. So today, to answer your questions, we have an experienced panel of recruiting professionals. We have Morgan Falgu. She is the Career Outreach Supervisor. Ashley Borderlawn and Lisa Demore are individuals from our recruiting team, and they'll be answering your questions today. If you feel like you have any questions throughout this session, you're welcome to give us those below in the chat section. Morgan will be answering those questions throughout the session, as well as at the end of the session live if you have any at the end. So to get started, the first question that I've been asked quite a bit this week in interviews is, what precautionary measures have been put into place to protect our employees and patients from the spread of COVID-19? What do you guys think?
Everyone, thank you for joining us. As Cameron mentioned, my name is Morgan Falgu. I oversee all of our career outreach team in human resources at Ochsner Health System. So I'm really excited to be here today with you guys and connect. So I think that's a great question that you're asking, Cameron. I think obviously this is definitely a concern right now for all of our clinicians, whether you're experienced or a nursing student or about to be a new grad nurse. What precautionary measures are hospitals taking to best prepare their staff? So I've been really impressed with Ochsner, honestly. I think the communication has been excellent coming from executive leadership across the system to keep us all in connection with each other and kind of following that one message and the one directive. We specifically have put together a task force directed towards COVID-19, partnering our infection control department, human resource department, physician leadership, nursing leadership, employee health, all of those key components, as well as our supply chain team, to make sure that we're all connecting and talking about what is needed to keep our staff safe. Some really great measures I think we implemented very early on that we've seen great success is at all points of entry, we have our temperature check stations for both employees, visitors, and patients. Also for our patients, we have our EPIC prompts at the specific patient portals so we can ask those critical questions to better determine their exposure to COVID-19. We're also keeping up to date with the CDC's guidelines and implementing all their recommendations for hospitals to best prepare our staff, as well as making sure we are completely stocked on PPE and we have the resources needed for our employees. One new thing that we started in the last week is ensuring that we have a PPE liaison in all of our inpatient nursing units. That's someone there to help guide our staff to ensure that they're wearing their PPE correctly and that they have access to PPE at all times so they can properly care for our patients.
Whatever necessary steps required to make sure that we're taking care of our patients, but as well as, our team members. So as people are ready to get involved, they're ready to join the Ochsner team, what positions are available right now?
I'd like to answer that if I could. My name's Lisa Demore. I'm one of the senior recruiters. My main focus is Jefferson Highway campus on the South Shore. I recruit for critical care as well as peri-op services and some case management and corporate positions. But what we have open right now is a plethora of positions. We've got, first of all, our SNAP program, which is going to be a system nursing assistant program, and this is more designed for nursing students. So if you've got a semester under your belt and you'd like to come on and be an extra pair of hands for us, we'd like to have you be a part of that. And I know they are taking applications and interviewing right now. So that is something you might want to jump on. Another program we have is our nurse tech program. That's for our senior students. So if you want to go ahead and look for one of those positions, those are the ones that are going to be getting ready to graduate probably in December or next June. And we do always have openings there. Of course, we're always looking for you experienced RNs out there. We need you dearly. And there are openings across the board. The main focus is, of course, our needs right now is going to be med surg, ICU, and ED. And our new grad RNs as well. We've got focuses there as well. We have openings across the board in med-surg, ICU, and the ED. So I hope that you'll go and take a look at our website and find what's the best fit for you.
Very cool. It sounds like we've got some really cool opportunities for our new clinical professionals to join the team. So when we talk about SNAP and we talk about the new Grad RN program, what is really the difference between those two programs?
That's a good question. But the SNAP program is more designed for immediate. We put that in place in response to the current events, and so that's something that you can get on board right away with. A nurse tech might be someone that's a little further along in the program as well, as far as being closer to graduation. We do usually have a nursing assistant position available, and that would be someone that's looking for something on a permanent basis. Does that answer your
Okay.
question?
Oh, absolutely,
Okay.
absolutely. And then Morgan, what do you think a good cultural fit kind of looks like for an Ochsner team member for either of those programs?
Yeah, absolutely. And kind of, I love what you said, Lisa, just kind of breaking down what the current opportunities are. Lots of great things for both our nursing students and our soon-to-be nursing graduates in May. I kind of want to talk a little bit about the skills and qualities needed for each, but I think it's great to understand the two different programs and where you would find your best fit. So I think as a nursing student, if you are, kind of adapting to the challenges, right, of now being a virtual learner and not being in inpatient units, working directly with patients, and learning those skills, right? I've heard about virtual clinicals and different assessments that you guys are doing, which I think is very innovative. But I'm sure as a nursing student, you're wanting to be able to work with patients and be able to have that direct patient care opportunity. So I think the SNAP program is an excellent way to help supplement your education right now, be able to work directly with patients. So if you're kind of looking for that and wanting to be in the hospital and care for patients, then what a great time to learn and get a strong foundation for your nursing career during this time as we kind of embrace the unknown with COVID-19 pandemic and how we care for our patients. So you're going to learn how to put on, that personal protective equipment, PPE that I talked about earlier. You're going to learn all the steps in place that our nursing staff is taking to best care for patients and protect themselves. So I feel like that's a great opportunity for someone that's missing that patient experience component of their nursing school journey. And then for our new grad nurse program, I think this is great for someone who is maybe really unsure, right? What a unique situation to be in. You're about to graduate, and maybe you were already applying for jobs and going through the interview process, or maybe you were waiting to put in your resume and start applying, and this has kind of changed things for you. This is a great way to get on with a company that is committed to seeing you through your career as a nurse, and it's going to work with the State Board of Nursing on their best practices on how we can transition you from a nursing student that's going to finish school in May 2020 and get you that RN licensure. So Ochsner is going to be able to kind of hold your hand through that process and making sure that you're staying up to date. You don't have to do that on your own as you transition from nursing student to a nurse. So I think it's really important that the skills needed for all those jobs is someone that's wanting to get very involved, excited to go work in a fast-paced environment, but also ready to learn a great foundation, like get that strong nursing foundation, right? I think you're going to learn that no matter what program you go into if you're a student right now. But as always, some commonalities that we look for in our applicants, we're really looking for people who can identify with our Ochsner core values as well as live them out each day. They're on our website. I highly recommend checking them out if you're going to apply for a job at Ochsner, or even just talking to a recruiter to better understand who we are as an organization and what the culture is like here. I personally am a huge fan of the core values, and I love to share them with others. I think some of the key ones that we are seeing being lived out every single day, especially amid COVID-19, where we're having to demonstrate them to our best of our abilities, specifically compassion, right? Being compassionate to one another, our colleagues, as well as patients and their family members. I think that's really important, as well as patients as the first priority. What a unique time to care for patients, and so we need to make sure that we're putting them first, right? And always providing the proper care for them, and especially when we're still learning, right, about COVID-19. So it's really important that we're able to do that. And then lastly, teamwork. Teamwork is a huge one. I think I look at the faces on here and I see people that are part of my team that I get to work with all the time, but it's really a huge teamwork environment at Ochsner, especially for a nurse. I think no matter when you're starting your nursing career, you want to work on a strong team, but particularly right now. You need to go into an environment where there is teamwork, there's someone there to help you, someone that you can ask questions to, someone that's there to support you. And so I really think that all of our teams are really exemplifying that. I love going on our Ochsner Careers Facebook page every day, as well as our Ochsner Health Facebook page every day, where we're highlighting heroes and some of our teams and how they're working. So I think those are all really great qualities and things that we're looking for those roles.
Okay, and it sounds like two really great opportunities for our nursing students and our new nurses to get involved, in addition to any experienced RN. And when I mention those roles, does that mean they're full-time, or are they part-time, people work in a part-time capacity?
Hey, Cameron, I'd like to answer that. My name's Ashley. I'm a recruiter. I support St. Bernard Parish Hospital in Chalmette, and I also help support Jeff Highway as well. But throughout the system, there are full-time positions, and we, of course, would love for anyone to join us in a full-time capacity. But throughout the system, there are PRN and part-time positions available too. We understand schedules don't always allot for full-time, especially maybe nursing students. That would be a good opportunity to utilize some PRN opportunities.
Okay. And then benefits always come up when I, talk to students and when I talk to people who are interested in careers with Ochsner. Would team members that are hired during this time be benefits eligible, and are those benefits extended to their dependents?
Yeah, absolutely, Cameron. I think this is a time where benefits are definitely a great focus for anyone, any job seeker. All of the jobs that we're hiring for are benefits eligible, as well as for their dependents and family members are able to receive those benefits. Specifically with the cost and the specific benefits package that you will be receiving can depend on your job that you're hired into. So just like Ashley mentioned, we have full-time, part-time, PRN status, so the cost associated can vary depending on that status, but all employees will have access to this healthcare benefits. We have 401k benefits, life insurance, tuition reimbursement, really excellent benefits here as an organization. Again, that I highly encourage you to look into before applying to a job, just to get a great overall picture of what we have to offer. But specifically some things that Ochsner has implemented as benefits for employees during COVID-19 that I think are fantastic and really speak to how we're caring for our providers and our clinicians, or the employee assistance program benefits that we've implemented. So a little bit about the employee assistance program. It's got a couple of different components to it. One is an employee assistance fund that actually how we receive the funds for that is through our annual giving campaign. So internally, employees can donate for this fund. It's really to be utilized in times of need for our employees. And so right now, more than ever, we're seeing families greatly impacted by COVID-19, and some of the changes in the economy are really affecting people's families and lifestyles. So they're, as an Ochsner employee, you're able to apply for a grant through the Employee Assistance Fund and receive funds from the organization to better support you at this time. Another component of the Employee Assistance Program is also our mental health and well-being benefits. So we want to make sure that you are not only caring for your patients, but you're able to care for yourself during this time. So through the Employee Assistance Program, we have one-on-one counseling through virtual chats just like this, like Zoom, with licensed mental health providers, as well as wellness and mindfulness groups. And we also have an Office of Professional Wellbeing, which I think is a fantastic division of Ochsner that is also implementing some self-guided resources for staff if maybe you just need to take a minute during the workday to have a few moments to personally self-reflect. In addition to some of those, in addition to the employee assistance benefits that I discussed, some other great things that we've implemented for staff is childcare, right? What a critical time to implement something that's going to impact so many people. So completely free childcare for our employees that's offered Monday through Friday, all across the region where we have facilities. So really great to see Ochsner doing that, to be able to support our staff members who have families at home that they need to provide for. And then lastly, I think one of the things that's pretty exciting is some of our pandemic pay incentives that we're offering, which I think is, an excellent piece that we're adding to help supplement some of the work that everyone's doing with COVID-19 patients. Caitlin, you want to pull up that slide and we'll kind of talk through it? Thanks, Caitlin. So I just figured it'd be easier for everyone to kind of see the visuals specifically of what we're offering for pandemic pay. So this is additional pay for every shift worked to compensate for the demands of the COVID-19 pandemic. So you're going to be eligible after working 3 shifts in one of these highly identified departments that are seeing some of the majority of our COVID-19 patients. So RNs working in the emergency department and med surg department, as well as RNs in adult critical care areas, to receive these additional shift incentives.
Okay. So we've talked about some really great benefits, including health benefits. We've talked about childcare, competitive pandemic pay, and even our employee assistance fund. So how is scheduling decided if someone decides to apply for one of our roles and move forward with accepting that role?
I can answer that, Cameron. Your scheduling, and I think some of the others have referred to it throughout the program, is it depends on students and maybe other positions that you might have. So the scheduling would be done with the leader that you'd be working with based on the needs of the facility, of course, but they're more than willing to work around what your schedule is right now. So they're looking for some extra help or full-time, but definitely willing to be flexible with that.
And then what about the unit and the campus? How do we decide that? Or do we have availability at all of these campuses?
We do. We have opportunities at all the locations. The highest priority, of course, right now is going to be the South Shore because the main focus is going to be in the New Orleans area. And any recruiter that you would speak with can talk to you about your preferences. So if you really have a preference for New Orleans or the West Bank or Kenner, then they're going to make sure that you get an opportunity to talk with the right recruiters. If it's St. Bernard, then definitely they're going to make sure that that happens for you. Of course, the highest area of needs in all of those is going to be the ICU, the ED, and the med surg, because that's where we're seeing the volume of patients right now.
Okay. And I know you guys have been working really, really hard to get those individuals in. Ashley, this one's for you. What type of interviews will the potential hire participate in?
Sure. So we are still conducting our phone interviews, and with technology like this, a lot of managers and recruiters have used Zoom so that you could still get that personal connection while practicing social distance.
Yeah, absolutely. And then what about orientation and training? How do we get those hires acclimated to the system?
Yes. So like Morgan was saying, Ochsner is following CDC guidelines. We are practicing social distancing. So our clinical orientations have been condensed to a half a day, and they're smaller orientations now. They're offering a lot of different sessions throughout the day so that we can make sure that we are following that guideline. And in those orientations, they'll go over all of the procedures that Ochsner is already following, with hand washing, temperature checks, PPE, infection prevention. All of that stuff is covered in orientation for our clinicians. And then they have also moved to virtual orientation for Epic for our EMR system. And then for non-clinical people who are onboarding right now, we've moved to virtual modules online through Ochsner's Learning Network. And then that gives the opportunity for those people to report to their department on day one.
Okay. And then, so when we consider how many, hospitals we have across the system, there's also, lots of opportunities for people that move around. Is relocation provided for some people who, might be out of state and are willing to help with the COVID pandemic here in New Orleans?
Yeah, we are continuing to provide our relocation packages for the employees that live 75 miles away or further. That is standard that we have. And we're offering relocation for critical areas, especially experienced nurses, and those are for full-time roles only. So we're looking at med surg roles, ED, and ICU certainly for all areas. But we are offering relocation and something we can talk about on a case-by-case basis.
Okay, sure. I also wanted to take the opportunity to mention that we've made it easier than ever for you guys to apply. You can do the show by texting OH to 22100. Again, that is OH to 22100. I'm sorry. Once you've completed the questions required, someone from the recruiting team at Ochsner Health will reach out to provide next steps. I'd also like to remind you that we're hiring experienced RNs and LPNs in our high need areas, and that's ED, ICU, adult critical care, and med-surg and med-psych. Additionally, we're hiring for that SNAP program, and that's for those nursing students who haven't yet graduated but would like an opportunity to get some hands-on experience. And I think that's all the questions that we have for you today. Our recruiting partners will be on for a little bit longer to answer some more questions for you guys. If you'd like to ask those questions using the chat feature, we'll be answering those questions live for you. I'll also be providing the links for you all within the chat for our virtual careers page. For that virtual career page, you can find out more about all of our careers at Ochsner or chat with a team member directly one-on-one at any time. And you can do that through text or online. Also, the SNAP program for our nursing students that are ready to apply. And I'll also add a direct link for the new grad nursing program if you're graduating and you're ready to get to work on our front lines in either one of those areas I mentioned today. Thank you guys for joining us. And again, we'll be responding to any of your questions for a few minutes using the chat feature here, a part of Zoom.